So briefly, I think this study really highlights how studying rare tumors can help us understand the biology of much more common tumor types. And the rare tumor type that we studied is called a juxtaglomerular cell tumor. My name is Shaunak Gupta. I'm a consultant in the Department of Anatomic Pathology at the Mayo Clinic.
I'm Vidit Sharma. I'm a urologic oncologist at Mayo Clinic, and I run the nephrectomy registry here.
We're going to briefly talk about a paper that we worked on that's going to appear in an upcoming edition of the Mayo Clinic Proceedings. The title of the study is Renin Production by Juxtaglomerular Cell Tumors and Clear Cell Renal Cell Carcinoma and the Role of Angiotensin Signaling Inhibitors. This was a multidisciplinary study with collaboration from individuals in the Department of Pathology, in basic science laboratories, as well as in the Department of Urology. And just to give you a sense of how uncommon this is, we saw over 10 cases in a 20-year span. And so what's unusual about these tumors, which are by and large benign, small tumors that are 2 to 3 centimeters in size that occur in younger patients, is that these tumors produce a hormone called renin. And renin contributes to hypertension in these patients. And often the tumor is undetected, and these patients present with very high levels of hypertension, which resolves once you resect the tumor. And while we were studying this tumor, we asked ourselves the question whether or not this is present in other tumor types. And that's where we had a very surprise finding. And I'll let Dr. Sharma talk about this part.
For my role in the study, we examined 1,200 patients with clear cell renal cell carcinoma, which is the more common and more conventional type of renal cell carcinoma. About 65% of renal cell carcinomas are clear cell. And we examined the implications of ACE inhibitor use in the population of patients undergoing nephrectomy, either radical or partial for clear cell renal cell carcinoma. So for our first analysis, what we found was that, importantly, a high percentage of patients, 63% of patients with clear cell RCC, had hypertension. So that correlated with some of the genetic and genomic data that Dr. Gupta's team worked on. And then the second part of it was to examine in patients who have high existing hypertension at the time of nephrectomy, does the use of ACE inhibitors or angiotensin receptor blockers, ARBs, impact outcomes? And so essentially, to summarize, we found that patients who had pre-existing hypertension who were treated with an ACE inhibitor actually did have improved progression-free survival compared to patients who did not, or compared to patients who had hypertension who were not treated with ACE inhibitors.
So to summarize, some of our takeaways from this study is that while we were conducting this, we developed some tools that can be widely used in labs across the world, one of which is standardization of immunohistochemistry for renin. Traditionally, we've used surrogate markers or electron microscopy, which isn't always available to find certain specific ultrastructural details for these tumors, but having just understanding the normal histology of these tumors and being able to optimize these immunostains allows us not only to study these rare tumors, the juxtaglomerular cell tumors, but also identify the more common tumors, the clear cell renal cell carcinoma, that express renin at much lower levels within their microenvironment. And future studies could look at how we could optimize treatment of these patients with the inhibitors that Dr. Sharma just mentioned.
On that note, I think the real promise of this work is, we have identified high renin expression in clear cell RCC patients, and then we find an association with ACE inhibition in the subset of patients with clear cell RCC undergoing partial radical nephrectomy. And so the next step would be to specifically examine patients who have a high expression of renin in their tumors, and then compare the outcomes of ACE inhibitions in that subset of patients. And that next study is being planned.
So we would like to encourage you to read our study, the results of our study in the upcoming November edition of the Mayo Clinic Proceedings. And please feel free to reach out to either of us if you have questions regarding the study.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.